All right, everybody. Thanks for joining us. We got several more coming in. Grant Zarzour, and thrilled to be talking a little health and longevity with you today. It's 11 o'clock on the dot. We're going to give everybody just a few more seconds to come in as everybody's kind of piling in actively. But I want to go around the room and let everybody say hello here. We're going to start with Dr. Sharma and Sid Sharma in Atlanta. How are you?
Hey, nice to be here, Grant. Thank you. I'm Sid Sharma. I am here in Atlanta with Sperity. I'm a board certified family physician, and that's what I've really been doing for the last 20 years. Till recently, when I decided that I wanted to go ahead on my own and start my concierge practice. And that's right about the time when I met Grant, and right away we just clicked, and we had the same idea that we wanted to provide healthcare that wasn't that tied into the whole insurance model, and really just to do something for the patients where the doctors can spend time with the patients and really provide them with cutting edge and whatever the new modern medicine has to give to these patients. And that's what I ended up doing. And here we are 2 years later. I find myself really spending time with my patients. One of the unexpected things that came out that I do have more time for myself. I'm working out 5 days a week, spending time with my kids and loving it. Thank you.
That's great, Sid. Thrilled to have you up there running the show for us in Atlanta. And we also have our Chief Medical Officer, Dr. Coby Harrison, with us, who's down in Mobile.
Thank you, Grant. Coby Harrison here. I've been in primary care, private practice, multi-specialty, very busy clinic for the last 10 to 12 years of my life. Raising 3 little girls and just hammering away on a hamster wheel, an RVU generating machine. And my goals for primary care are not really aligned. I realize, kind of halfway into that, my why I got into this is when my daughter, my middle child at 18 months old, was diagnosed with a very rare hematologic malignancy, blood cancer. I felt, my husband being a doctor and myself, that we were well prepared to navigate the healthcare system for this little baby. And we, of course, did the best thing that we knew to do, which is where we trained at UAB. We went in Birmingham. We went back there, and, it's a great place. But I kind of learned that, if you don't do this every day, no matter how rare a condition may be, you still don't know what you don't know. And then that led me to go and find a center of excellence for her very rare, extremely rare blood cancer. And there's a center that does nothing but that. And so part of the right doctor, right time, and how I got involved with Sperity is that experience and the care that we got at Texas Children's really changed me as a physician forever. I could never now spend 7 minutes in a room with a patient that has a serious concern, and that's changed the way I want to practice forever. And I think that primary care starts outside of the clinic. I mean, we need time to explain how to live a better lifestyle, not just pat on the back, see you next year, your labs look great. And so that's really what brings me here, and I've thoroughly enjoyed it. I like to study and look into every detail and leave no question unanswered.
Thrilled to have both of you on the team. Many of you know me, Grant Zarzour, orthopedic surgeon by trade, glorified carpentry, but became real passionate about proactive care. Similar to Dr. Harrison, a family issue kind of led me here. My poor dad got a dadgum brain tumor, and we had to navigate the healthcare system, and it was so challenging. And then my son had some illnesses he battled and diagnosed with autism at 2 years old. And we celebrate his 11th birthday this afternoon, and the boy is flourishing. And, we were talking last night. This is a kid we didn't know would talk in sentences. We didn't know would be able to go to regular school. And he's doing all of it and flourishing. He beats me in chess routinely. And he's kind of the class clown, which he gets honest from dad. So we're all here kind of united in a passion to focus on proactive care. And I really think that the future is going to be lowering risk of cancer and cardiovascular disease and dementia. And that's why Sperity Health exists. So the format for today, I'm going to show you here. We've got some of our topics we're going to bring up. A day in the life of the member. We're going to cover some of these topics, but we want your questions in the chat. All you have to do is type on that little chat, and you can then ask us any question you want. And we're going to get to those after we run through what we get asked all the time. So some of these questions have already been emailed and asked in advance. So we're going to jump into those in just a second. I mentioned our mission at Sperity Health is in one sentence to lower your risk of cancer, cardiovascular disease, and dementia by 50% based on data and science, not snake oil and Instagram. We're gonna focus on that today on driving those home. So we'll go through these real quick. The first thing I'll tell you is kind of the day in the life of a Sperity Health member. We love a year-long relationship with the member. That's why we're able to really drive change, is that it's not a one-day change your behavior for a week and then go back to where you were the other 51 weeks out of the year. All of us will agree that longevity is a year-long commitment. You don't have to be perfect, but we're trying to beat yesterday. So our big differentiators for us, one, that our team comes on site. One of our MDs who specializes in this area of medicine, internal medicine background, formally trained, are going to come on site and give you the do's and don'ts, along with our nutritionists, phlebotomists, exercise physiologists. But the other differentiator for us is data and science are our North Star. We have all sorts of great conversations on what's the best thing to be doing and when, and it's based on what does the data say. So we're really focused on that. And then number three, that year-long engagement, we're going to put a wearable on you. We love Whoop bands and Oura rings. We love continuous glucose monitors. We love showing you your data. So a day in the life is kind of going through the process of learning what all you can do. We're going to hit some of these fast ones while your questions are coming through the chat. Sid, I want to throw it over to you on early detection. I know that's a passion of yours and ours, but tell us kind of your top three early detection labs that this crew should be thinking about and asking their doctor for.
Yeah, I think right off the bat, just to add to what a normal primary care doctor will show you, your lipid panel and your CBCMC MP, I want all the patients that you should be asking your doctor, hey, have you run an advanced lipid panel? Now, even in that panel, if you can just take one lab home with you, that would be the lipoprotein small a. That's the one that is a very good predictor of how much plaque, or if you're going to have plaque in your system. Perfect example, one of my patients, 55-year-old guy, he plays golf, he works out, pretty healthy. His cholesterol panel looked good. But just something in me told me, I think I should do an advanced lipid panel. We got his lipoprotein A, showed that he had those genetic tendencies. Based on that, I added some imaging, a CT angiogram, and lo and behold, he had 70% blockage. Now, this would be the guy that goes to the doctor regularly, does everything right, but he might have had a heart attack in the next few years. So we were able to modify some of that risk based on this advanced lab testing. So that's a definite must. Please tell your primary care doctor, check this. The second one that I like is the fasting insulin level. That can really show us trend, how you're doing over the years. You probably get a hemoglobin A1C done every year, but that number can take 4 or 5 years to show abnormality. So you're going to get a report, hey, your hemoglobin A1C looks good. You're not diabetic, you're not pre-diabetic. We'll see you next year. But if we are actually tracking your fasting insulin, we can say, hey, you're showing some tendency that could lead to a problem in the next few years. Let's do some intervention, maybe lifestyle changes, maybe adding a supplement that you can use and change that. So that's really important. So please ask your doctor, can you do this? And the last is one of my favorites is testosterone. I think everyone should really know about their testosterone levels. For guys, we know it, we do it, we ask our doctors, but I think for females, it oftentimes get pushed under the rug. And I know this is a favorite topic of Dr. Harrison, so she'll probably talk about it. Perfect example would be someone like my wife, who's 49 years old, didn't really have her testosterone checked. Normal number is 0 to 50, hers was 4. And that's the problem. That's why she didn't feel like going to the gym. She felt tired, fatigued, fogginess. So once you get that testosterone level checked and we can fix it, I think that's a game changer. So those are the 3 ones really should be testing.
Well, I think those are great. And 2, it segues nicely into the hormone discussion. But, I've got close family friend got their testosterone measured, also a female, and it was a 2.
Yeah.
You just don't know. And it seems like it affects women a lot more than men on hormones levels. So Dr. Harrison, your thoughts on hormones to the rescue?
Yes, thank you, Sid. That was an excellent and Grant, excellent discussion there. I could go on and on about LP-A and A1C and insulin resistance, but I will save you all because I think that is my own little fascinating excitement over insulin resistance. But so perimenopausal hormone replacement therapy is really what we want to bring light to when it comes to longevity and asking your physician the right questions. So there was the Women's Health Initiative study in the 90s or early 2000s really scared a lot of women away from estrogen. And when I came out of medical school, the thought was no estrogen for anybody after menopause. You are fine. You don't need the hormones. And what we've kind of realized from that after reanalyzing the data, and I could go into that, but it was not really a flawed study. It just examined the wrong patient population, the wrong route of delivery of estrogen, and was not really added at the right time. And so what I mean by that is really around the age of 35 to 40, women start having a very rapid up and down of their hormones, depending on what type of birth control, whether or not they have a uterus. So that all plays a huge role into maintenance of muscle mass, cognition, your risk of dementia. Even so much, I'll even say is your neurons will not respond to your antidepressant or your dopamine increasing activities such as exercise or cold plunging or sauna if you do not have your estrogen and progesterone and testosterone levels in a proper balance. It's not incredibly high or we're loading on. You want a physiologic level. It's a very normal
And that's a
level
big
that women
takeaway
should
to me,
have.
Dr. Harrison, is like, well, you got people trying everything, doing everything right. And because they haven't had their hormones evaluated, it's not working. And they think, I just can't lose weight. I just can't get happier. I can't. And it's not their fault.
Exactly. And I'll add one more piece to that. I have a patient that I followed for 10 years, knew her very well. She's a very high functioning female, very big job with a lot of responsibilities. And she had a significant situational life stressor that came along right at the time of menopause, and that disrupted her sleep as well. She became completely unfunctional, couldn't work, had to take a 6-month of leave of absence from work. And when we really got into it, starting her on hormone replacement therapy changed her life. She came back in 6 months, and she had stopped a lot of her SSRIs, medications like psychiatric medications. There's been a lot of times in the last 10 years that I've written a Lexapro or a Cymbalta when I think the answer really could have been, hey, let's look at where you are in your hormones and let's explain why you feel this way. And not a lot of physicians know how to answer that, especially when you're pushed on time and getting in and out of the room as fast as you can. So our goal here is to educate women on why hormones are important for a longevity aspect as well, because in the right way, they can reduce your cardiovascular disease, reduce insulin resistance, and reduce your risk of dementia if they're started in the proper timing and appropriate doses.
So we work to check hormone levels in all of our members at some point in their journey with us. And, certainly the early detection labs that Dr. Sharma mentioned, all 3 are included on the Sperity Health membership. And leading into, there's certainly lots of things you can spend money on. And I know that many of us out there get on Instagram and we click things and links, and all of a sudden these things show up at our door. But I want us each to give kind of one thing that the room needs to stop spending money on and throwing it down the toilet. Dr. Harrison, speaking of the toilet.
Cleanse, anything that is a cleanse. I can't stand a cleanse. The best way to cleanse the body is by natural fasting and water and giving yourself a 24-hour period without eating. That is the best way that you can cleanse your body. And it's free, and it's even cheaper because you aren't paying for food that day.
That's right. Dr. Sharma.
Oh, yeah, that's an easy one. Vitamins, IV infusions. I really don't think that makes sense because all these are water soluble. All you're really doing is just creating expensive urine. You can get the same benefits with some tablets or over-the-counter vitamins. So no need to spend $350, $400 on these IV infusions where it's time commitment, financial commitment, and then, you're increasing the risk of infection. Someone's coming in and putting an IV. I don't know how they're trained. So that's not one of my favorites.
I will tell you that's a good way to interject. When we check labs on our members. We have kind of the tip top phlebotomy team. I tell people that they're so good that even a male can have their blood drawn with Sperity Health, because we find the tough stick phlebotomists who can find a vein in anybody, and we pay them a lot because we want the experience to be great. Phlebotomy is real important to us because it's a big part of our plan. Mine first stopped sitting on us. There's something out there that just drives me crazy called plasma exchange, and people get a picture with their filtered plasma. You put your entire blood volume through this plastic tubing with God knows what forever chemicals in it. Plasma exchange works great if you have a severe immune issue or like a problem but for the vast 99.9% of us, plasma exchange is a waste of your money. So look, we're saving you some money here. You didn't think you'd hear that. We're going to keep going as questions still keep coming in the chat. Some are going straight to David, who's hosting this, and some are coming all out to all of us. So you can choose whichever route you want. All right, we're going to now keep going on to next topic. I'm a big fan of this. Sugar being the devil. And I'm going to turn it over to Dr. Harrison in a second to talk about sugar and how insulin resistance plays a role. But what I tell my patients in the clinic is put down the caramel frappa mocha chocolate that you're drinking for breakfast. It's 1,000 calories, 100 grams of sugar, and you can't lose weight for like 2 days after you have one of those things. It just messes everything up. Sugar tastes so good and it is so bad, but I just really believe that it really helps cause cancer, cardiovascular disease, and dementia. So now we're not telling you got to be perfect and never eat a piece of pie again. I just choose not to drink it. So I try, my 3 drinks are water, black coffee, and then I have the audacity in Alabama to tell patients not to drink sweet tea, but instead unsweet tea, which does not go over well. But if we could take the sugar out of the drinks, and the fake sugar's got its whole host of issues as well. So just no sugar. But why does that matter, Dr. Harrison? Am I just being crazy?
No, I love that. And that's exactly what I tell my patients. You know, there certainly are small steps that you can make. And that's the first one that I say is don't drink sugar, because for one, you don't get filled up. You are able to then eat a large plate in front of you, and the sugar is just kind of like going straight into your veins. And that's a direct driver of insulin resistance, which, as I was saying earlier, if I could describe that in the easiest way, that is a recipe for weight gain. And like insulin resistance actually goes back to the brain and tells you that you are more hungry, eat more, in some recipe of hormonal balance. And it's all hormonal, but sugar feeds that recipe for weight gain. And yes,
exactly.
Malignancy increases mortality. Insulin resistance is one of the biggest things that if we intervene on earlier, we can make the biggest change in your mortality for cardiovascular disease, kidney disease, everything that comes along with all of small vessel disease, just driven by insulin resistance in our Americanized diet.
Yeah, the old Americanized diet, the standard American diet, the old acronym is the most appropriate. Sad, because you are what you eat. We've known that, but we just like to help people monitor it. And I'll tell you, there's all sorts of noise out there on weight loss these days, but our favorite thing for weight loss is a continuous glucose monitor, which shows you your body's relationship with sugar. And some people can eat certain things and their sugar goes up, and other people can eat the same thing and nothing happens to their glucose. You have to learn for yourself. We're all different. Our DNA is different. Our genetics are different. So you need to learn what your sugar does to your body individually. So we put a CGM on all of our members for a minimum of 1 month out of the year. You're paired with a nutritionist and go over those data to see where you're struggling, where your successes are. So we love battling insulin resistance. It's just like a 401k, the earlier the better.
And that's what I'll say too. Even in 18 to 20-year-olds, I think what I really like to put into is that you think you're invincible in this 20 to 40-year-old range of your life. And in showing you people there how they are insulin resistant and how they are already setting up for the disease processes that are to come down the road if they continue to eat like that. Because you think, if I'm 18, I'm exercising, I can eat and drink whatever I want. And that's what I really want to bring awareness to with the CGM, is that that's not the case.
That's right. Real impactful there. All right. We told you some things not to do a minute ago. Now we're going to tell you the supplements that we actually like. And so there are a few. So Dr. Sharma, tell us yours first.
Oh, I have a huge list, but I will tell you my top three. I'm a big advocate for protein. So me being mostly plant-based diet, I try to get in at least 120 grams of protein, and a lot of times it's hard. So I'm a big fan of protein powder. I use a plant-based protein powder, so at least 50 grams of protein coming from there. So that's my number one. I make sure that twice a day I'm getting a protein shake. The second one is the fish oil. High fish oil, I think it really helps. I do have a little bit elevated cholesterol, so rather than taking a medication, I think just controlling the diet, exercise, and putting in fish oil, which helps with lowering your triglycerides. It has shown to stabilize the plaque in your arteries. There are some studies that it can lower blood pressure and really good for DNA repair. So that's definitely one of my favorite ones. And vitamin B complex. Now, a lot of people just like to take vitamin B12, but I've found that actually taking the vitamin B complex can have really great results with fatigue, mental clarity, hair and nail, and things like that. So I always make sure rather than going for an IV infusion and paying $250, a B complex at Costco is like, I don't know, $15, and you get almost 3 months, 4 months supply in there. So those are my three top ones. And I think everybody should be taking those.
So we got protein powder, fish oil, and B complex. And, I'll tell you, we look at, yeah, we're going to turn up. We've looked at kind of great sources for vitamins and supplements. And I'll tell you, Costco Kirkland really has some high quality, there are a lot of companies that'll sell you their branded supplements for a lot more money. Sperity Health is not one of those. We're going to connect you with the best sources that also don't break the pocketbook. So, and there's several others, but Kirkland is pretty good. Dr. Harrison, your favorite supplements?
Yeah, so piggybacking onto what Sid said, of course, I agree with him 100%. I use the fish oil in the scenario where if I were eating a very healthy piece of fish with the skin on it every single day, ideal circumstance. But the reality is I've got 3 kids. We might hit the Chick-fil-A drive-through a couple times a week. And I hate that, but that's my life right now. And so what I try to do is think about when we were hunting and gathering, we're not getting what we did then. If we had to go out, hunt and kill our food, we would have a lot more fiber, a lot more, of the natural things that we need. And it's very hard to get fiber in. Fiber is probably my top one, because to take a fiber supplement causes a lot of GI upset. And it's very hard to get extra fiber in your diet unless you're out, eating celery and tree bark. And so other ways to get fiber in your diet, educating patients on how to get fiber in your diet via natural ways, of course, in foods are the best thing, the best way. And then magnesium. Magnesium, our diet today really kind of washes out our magnesium. And there are several different types of magnesium, but essentially you cannot overtake magnesium unless you have end-stage renal disease, which those are not our patient population. But you can always take more and more magnesium, and magnesium threonate protects your central nervous system. Glycinate helps with relaxation, bowel regularity, and sleep. Basically, you can't really take too much, and there are really only benefits that I've seen so far of magnesium. And so again, I go with a Costco brand or something cheap on Amazon that is nice to deliver, that I don't mind taking. And recommend that pretty much everybody because of the support on sleep. Many people have leg cramps at night. I always go straight to magnesium and fiber, protein. Balancing your fiber to your carbohydrate intake is one thing that I think we really do poorly on. And I see that clinically in diverticulitis, chronic constipation, fatigue. We don't get enough activity. Fiber really needs to play more of a role in our diet. And we want to teach you with our nutritionists how to do that in a way that fits your lifestyle.
I think that's great. I agree with all of those. I will just add, my favorite is vitamin D3 with K2 to increase availability there. Vitamin D3, being an orthopedic surgeon, we love it for your bone health. We don't want as much osteoporosis and everything else, which, muscle building activity really helps with that as well. But vitamin D3, 2,000 units a day, everybody should be getting that, either take it by itself or as part of a multivitamin. Either one is great. Another, I'll add creatine, 5 grams a day in your coffee. Creatine, we've always known for muscle building, and high school and college age kids have been doing it forever, but now we're seeing cognitive benefits. So 5 grams a day in the coffee is one way we're doing, including that. And then this is kind of a supplement, but I'm pretty passionate about. We live in the South and there's a lot of sun down here. A mineral-based sunscreen for lowering your risk of skin cancer. Skin cancer is such a huge issue, and I think everybody needs a mineral-based sunscreen on their face every day. Yes, it can have a sheen on it. You got to find the one that works best for you. I will tell you, we give our members our favorites from each topic, our favorite mineral-based sunscreen, our favorite vitamin D, our favorite protein powder, our favorite fish oil supplement, like we even tell you we love avocado oil for cooking on the stovetop and which one to get it with. So anyway, those are my top 3. We're going to keep going here as we go. Popular topic, peptides. Yeah, everybody wants to skip diet, sleep, and exercise and just go straight to the peptide. It's the American way. But I want to get both of y'all's thoughts on that, on when is the right time to consider peptides versus when not. Dr. Sharma, you go first.
Okay. Yeah. That's the whole discussion on, TikTok and Instagram right now. Peptides, they're everywhere. But one of the first things that we want to understand is that these things are not FDA approved yet, right? So there is some risk as long as the patient understands that. There is a place for them. I think they're the emerging treatment. We'll find a lot more about them as the time goes on. I've had a few patients on different peptides. There are a couple of peptides, especially BPC 157 and TB 500. Grant, I'm sure you see that in your patient population. They come to you, they have some kind of a muscle tear where you don't think it's really necessary to operate on them. And you're saying, hey, go for physical therapy, maybe take a couple of weeks off from golf. And then these guys are coming back and they're like, I don't want to be on a painkiller. I want to play golf. And Dr. Grant's not going to operate on me. I've heard about these peptides. What should I do? And, for some patients, it does work. You do see putting people on some of these peptides can reduce the inflammation. It can help with some regenerative properties. And they're back playing golf and they're doing the thing. And some of my patients, 75, 76 years old, they're saying, hey, you know what? My hip doesn't hurt as much when I go up and down the stairs. Or, hey, I'm playing golf again. Do you think I should try pickleball? And I'm like, you know what? Let's not get crazy.
We love pickleball, Sid. We love as an orthopedic surgeon. Yeah, get out there. Weekend warriors. Everybody's out there trying
their best.
The
most searched word over pickleball. I'll add to that. Sid, 100% agree on the peptides. I think that, definitely under the supervision of a physician that you trust, and there's definitely a shared decision making there that like you might be taking a little bit of a risk. A non-FDA approved product. But if you're both on the same page, understanding the minimal risk and benefit ratio, I think that's definitely appropriate. What I would say too, as far as the like muscle building peptides, weight loss peptides, which kind of tie into GLP-1s, but, I think it is a nice little trick once you are already doing all of the basics perfectly. You are sleeping well, you are exercising to your max, or you're getting in all your cardio, you're eating perfectly, and you're doing all the things that we are implying that encouraging you to do well, teaching you how to do those well, and you maybe can't reach your visceral fat goal or can't reach an exercise target. Adding some peptides in a very careful way can be very beneficial, but still we start at the basics, and until you are doing those basics, I would say peptides is like chapter 47, but I am very excited about what they offer for the future.
We're not going to have our head in the sand about it. And BPC 157 is I have not used a peptide. That would be the one I would use if I had failed physical therapy, still had a tendon issue, or if I tore my Achilles playing pickleball. I probably would take some BPC 157. I wouldn't take any other hormone. And I'd only take it in those situations, but I really want to know that I'm getting it from a very good source and a great doctor I can trust, not off of TikTok.
Sources are huge.
Okay, we're going to keep going. We got some questions still coming in on the chat. And then David is texting me some that he's gotten already. So we're filling that up. Keep throwing your questions in there. We're going to hit these next few topics and then go to some more questions. I'll just share this story. The title is pretty self-explanatory, but we had a member, this was Friday last week, and 40-year-old female tested positive on a Cologuard test, which somebody asked about Cologuard. And we love a Cologuard test once every 3 years as a supplement to everybody should get their colonoscopy at 45 and as indicated by their GI doctor. Okay, full stop. Do not change that. But we love adding on a Cologuard. Every 3 years is the most frequent you can get it. Well, one of our members had a concern over a friend who passed away of colon cancer at 35. We did a Cologuard positive test. Sometimes it can be a false positive. In fact, a lot of times it can be a false positive. Got her connected with the GI doctor in her community, got her in, I think, 48 hours with a great GI doctor, and got a colonoscopy, and they found cancerous polyps that were removed, completely removed. And so the thought was, man, thank God you didn't wait 5 more years till you turned 45, because this would have been a problem before then. And, you think about the frequency of when you get a colonoscopy every 10 years, or 5 years, they want to see her again in 3 years. So close follow-up, but the GI doctor was like, this is great that you did this at 40, because I would not wanted to see what had happened by the time you're 45. And it's not just people, colon cancer is a risk for all of us because of our diet, because we don't eat enough fiber, because of that standard American diet. The lining of our colon is just being eroded with inflammation because of bad foods. Whole grains, fruits, and vegetables. We like 25 a week, whole grains, fruits, and vegetables. And that way you can really incorporate a healthier gut. But you got to do the labs and the imaging as well. So we love good Cologuard. Dr. Sharma, we're going to turn over to you about exercise. Is that the fountain of youth?
Absolutely. I think that exercise is the number one thing that you can do for longevity. Lately, as I was telling you, in my practice, I have this unique view that I base my practice out of a wellness center, which is basically the gym on the ground floor, and on the mezzanine, I have my office and my lab and everything. So I am there all day just watching these people exercise. And, now I have a lot of my patients in there and they're exercising, and I can see the difference. It's the same thing what we do for our Sperity patients, right? We're testing all these different metrics with your VO2 max. So that's one of the first things that you're going to see when you come on site day is we're testing your VO2 max. That's really telling us how you're using oxygen while you're working really hard. It's really giving me some input about your lungs and your heart. So all our members get that done. The higher your VO2 max, the better you are going to do as far as longevity is concerned. The next thing we're looking at is things like your heart rate, right? Heart rate and your heart rate variability. All these things are coming out from the workouts. What is your body or muscle mass, right? So the heavier things you're lifting, the better you're going to do. More muscle mass you're going to take into your 70s and 80s and be able to do the simple things like get out of a chair, or maybe take a carry-on bag on a flight to Spain or something like this. So exercising is the best thing that you can do. And again, as I said, Grant mentioned the Whoop device that we give all our clients at Sperity. There's so much data in there. We're checking your sleep. We're seeing how much strain your body is going through. So just compared to the regular doctor visit, hey, sleep more, exercise more. But we're actually telling you a lot more than that. We're telling you how you slept, not only just how many hours you got, but was it REM sleep? Was it deep sleep? And we can tell you the difference with the data that we get from the Whoop, how you should train the next day. Is it time to push it, or maybe take a day off? So our entire Sperity experience, we really are trying to help you train better and do the physical activities better, because we really believe that exercise will lead to longevity.
100%. That's great. Yeah, and I tell you, when our members get to do the VO2 max, it's a 12-minute test on the treadmill. It activates their amygdala, which is this small little spot in your brain that's your fear and emotional center. And we want you to be like, oh gosh, I can make this number better. Or I can, when we show you your CGM data, or when you see your app data with us, when you're seeing your sleep score and your heart rate variability, it's all about beating yesterday. It's not about being perfect. We tell people 5 days a week is the goal to be good. And the other 2 days you got roll tide, as we say in Alabama, or go dogs, or put your favorite team here. But it's so important to have that year-round engagement, and exercise is a critical piece. We haven't hit sleep yet, and we need to, because, we're all doing it hopefully about 8 hours or so a day. Dr. Harrison, tell us what your thoughts are on sleep and inflammation.
So I will have to say, sleep has been one of the things that Sperity has made me learn enough about to know that I had a problem with sleep. Again, I'll bring back to that invincibility piece where we all think we're invincible, in our 20s and 30s, and we can go all night and, pull an all-nighter for a test the next day, or whatever it is, or you can stay up later to get something done for the next morning. But the Whoop or any wearable device that is monitoring your sleep tells you, even when you wake up, if you feel rested, that you didn't get adequate sleep. And during sleep, if you're under stress, if your heart rate's going up, if you have a small collapsing of your upper airway, that is a stressor on your body, which leads you waking up into a higher cortisol state, therefore feeding back to the pituitary, increasing inflammation, contributing to insulin resistance, and contributing to functional hypogonadism, as in, like, that means poor sleep can lower your functional testosterone level, which may show up as normal in your blood work, but you can still feel like someone who has low testosterone. Sleep is the only lever that or one of the hugest levers that we have to reduce mortality, dementia, protect your memories, and reduce inflammation. It's critical. And we are trying to give you a tool basically that says, hey, start to watch it, because we are realizing the importance of it from a medical standpoint.
Exactly. I think out of diet, sleep, and exercise, sleep's by far the hardest to pull off. I mean, diet and exercise, we can start today, but sleep is a concerted effort, and it's so important. So we're going to make sure we keep focusing on that with all of our members. Okay, last topic here is, we're going to get some of the chats, and some of these chat questions we're going to get some of the answers with this one here. Dementia risk is doubling. If you're not afraid of dementia, you should be. We don't want you earning all this money and having a successful career and then having to battle, you or your loved one, dealing with dementia. I want to give you 3 ways to lower your risk of dementia. Number one, the easiest thing is a hearing aid. If you have trouble hearing, we don't want the blood flow to your brain and your auditory processing centers to dry out because you're not hearing things. So if someone in your family can't hear, it's non-negotiable they get a hearing aid. I don't care if they don't like the way it looks. I don't care. They've got to get one, because huge pathway of hearing loss equals dementia, and certainly can speed it up. Number 2, alcohol intake. I tell people that, again, the 5 days a week, try to be good. We're not telling you to never drink alcohol. Okay. We'd be out of business if that was our mantra. And I tell people, when I play golf, a whiskey front comes through and stalls on my foursome. So we're not telling you how to be perfect, but alcohol and your sleep really can go at odds, and your sleep got so poor, and then your dementia risk goes bad if you got an issue there. And number 3, I love dry sauna. Lowers your risk of dementia 70%.
Heat shock proteins.
Heat shock proteins. It dilates the blood vessels in your brain. It's making your blood vessels younger, and lowering your risk of dementia. Multiple studies out of Norway and Sweden where they dry sauna all the time. Sometimes in Alabama, when you dry sauna at 180 degrees, you get out and it feels the same. But dry, so it's 20 minutes, 4 times a week, 180 degrees. 20 minutes, 180 degrees, 4 times a week. There are little dry saunas popping up. Infrared's out there, wet sauna or steam saunas out there. We just don't have the data on that yet. They could be great, but we're just going to go with what the data says. So we love dry sauna. One of the questions, Mr. Colabella says, if he's got great in one ear and bad in the other. That's a good question. I think we need that one in that one ear. We want that auditory processing center on the bad ear to still be working. We want to get that plugged in and looked at. And again, someone asked about alcohol. We mentioned that there. Okay, let's go through.
I can speak on that if we want to talk more about alcohol.
Yeah.
Or
No, go ahead.
keep going. No, go ahead.
No, go ahead. We want to talk about alcohol. I think we hit it again.
Alcohol, I think, is probably going to be the Marlboro Red of our century here. I like the way that we look back on someone who smokes and has that pocket there with the Marlboro Reds. That's going to be where alcohol is, I think, maybe in 10, 30 years, hopefully sooner. But it's directly toxic to all of your cells, all of your neurons, terrible for your sleep. And the gut microbiome, it actually makes your gut more permeable, meaning like it breaks down the barrier where your bloodstream actually gets to interact with the bacteria in your colon. And there's a linear relationship to when you are drinking alcohol, how much of that inflammatory marker comes into your bloodstream while you have alcohol in your bloodstream. And as the two go down, they go down linearly. And so that is a direct relationship to how alcohol causes inflammation and therefore feeds back negatively to the insulin resistance pattern. And it does just havoc on your metabolic health because the liver pass. And so alcohol definitely contributes to insulin resistance on its negative effects on sleep. And I could go on and on and on and then be a real buzzkill, but alcohol is terrible.
Yeah.
Doesn't sell very well.
Doesn't sell all very well. Okay, a few more questions I'll bring up here. We do have individual memberships and group. We primarily focus on employers. So our goal is to help executives and employees live a longer, healthier life, to lower their health insurance premiums and improve culture, retention. We think if you're spending money on some sort of wellness benefit that's struggling with engagement or struggling with results, that you should switch it to Sperity Health. Because we're going to engage every employee that we can get access to. One thing we love is to do a webinar or an in-person meeting to do an educational talk where one of the three of us or someone else on our team comes and gives an educational talk to your team and says, here are the top ways to live a longer, healthier life. And then at the end, we see who wants to sign up. And if nobody wants to, then we'll walk out the door. But we have not had that problem. About 80% of the people we give a talk to want to sign up and look at their employer going, this is awesome. I've been looking for something like this, an engaging employee benefit that people ask us, who does Sperity Health appeal to? Anyone who wants to live longer. So it's kind of across the board. Office in New York City, we can go anywhere that a plane will take us because we love coming on site. Also, PRP injections for knee replacement instead of knee replacement. My thoughts on PRP injections and stem cell injections, usually the only person that benefits is your doctor's back pocket. It's just not going to change. We can't figure out how to put tread back on that tire. When you lose cartilage in your knee or your hip, the best thing to do is find a high volume joint replacement surgeon to put a new one in there. I'm biased, but you can't put tread back on the tire. And then
Hey, Grant, I just wanted to clarify. I just wanted to clarify one thing. You know, we've talked a lot about longevity today. We've been using that term. I just wanted to let the members and people on this webinar know that we're not necessarily saying we're going to make you live to 105. When we say longevity, what we're saying is that last 2 decades of your life, we want to make sure that you are healthy. You're doing the things that you enjoy. As Grant said, you've earned all this money. You don't want to just sit in a chair and watch reruns, right? You want to play golf. You want to travel. So we want to make sure that you are healthy in those last 2 decades of life. And if that's in your 90s and 100s, great, let's aim for that. But we truly are hoping that we can prevent a lot of the disease and accidents in that later part of life.
Absolutely, Sid. I think that was very well stated. I'll piggyback onto that briefly. Seeing what I've seen in the last 10 years in internal medicine is I've been taking care of really sick people that are in the bed, debilitated, and just because of chronic disease. And that is really, I'm good at that. I can do that, but it would be great to prevent that from the onset. And I want to see my 75-year-olds, my 80-year-olds cutting their grass, picking up their grandkids, picking up their great-grandkids, attending their grandkids' graduation, not having difficulty getting up the stairs, hopping on a plane and traveling without having to have assistance. Those are the things that we want to focus on when it comes to lifespan versus health span and quality of life in the nursing home at the end of your last decade of life is not really quality. And that's where we're focusing. Yes, says it.
Yeah, we're not trying to make you Brian Johnson and do the transfusions from your kids or whatever the crazy stuff. He does not look well. I think something he's doing is not working. But no, the goal is, I tell people, let's live to be 85 and mow the grass the day before you pass away. Still active, running around, kids, grandkids, traveling, whatever it is you want to do. But that's our goal. And it's just so clear. One other topic we've talked about, kind of genetics versus lifestyle and which plays a bigger role. And, it's become pretty clear. Your genetics, Dr. Allstead at UAB, who's the head of geroscience, the science of aging, he says 18% of how long you live and your health span is dictated by your genetics, and 82% is lifestyle and how you treat your body. And he gave this huge talk and all these different things. And it was diet, sleep, exercise were the big ways to move that needle. And you just don't want to wait until you're older to start that process. You can start anytime. You really can, but certainly the earlier the better. And our job is to be the quarterback to make sure when you're spending time, you're spending money and effort, it's going down the right path. Someone asked about HSA funds. We do have multiple members use HSA funds for their membership with us. A few other things on here, and the genetics for lifestyle we just covered. And that kind of jobs nice. Go ahead.
I could piggyback onto your point there on what we're trying to do is it's not necessarily early detection means that you're not going to suffer the consequences of a stage 4 disease. We're going to try to prevent you from getting to a bedbound state. And people say a lot of times like, well, I would take a bullet for my kids, but would you also get adequate sleep, limit your alcohol intake, and exercise so that you can be around with them longer? And that's really the same thing. And so it's, you want to be there for your kids. So that we're teaching you how to do that. It's not that you need a magic supplement, a magic medication. Everything is individualized. We go down to the basics: sleep, diet, exercise, and early detection. And that really is how we move the lever.
Exactly. Okay, last few topics we're going to hit. And with our last few minutes here, biological age versus chronological age. So, Dr. Sharma, you want to give some thoughts on that?
Yeah, I mean, I think that's exactly what we're trying to do here at Sperity. We know what your chronological age is. We know when Grant was born, when his birthday is. He is 43 years old.
He's actually 72, and we're doing a great job.
That's right. It has a heavy AI enhancement right now.
So with all the metrics that we are doing, all the early detection, we can actually come up with taking this data that we're getting from you and come up with a biological age. And what we're looking at is, hey, is Grant, given his chronological age, is he doing better and he is 5 years younger? Or, hey, he's not doing that great and he's actually 5 years older. So now we can sit down and say, hey, these are the markers. Look, your cortisol is high. We need to decrease the stress, or your cholesterol is high. We need to fix this. And those people can come back and have some of those metrics rechecked and say, hey, look, I was able to cut it down by 6 months, 1 year, 2 years. So now we're putting you in a competition with yourself, with your age. I can do better and I can decrease my biological age. And so that's when you go to a party and say, oh my God, you don't look 50 at all. So that's the goal, right?
Exactly. It's another way of gamifying your health, and employees need that. They need a way to kind of compete, and it just increases engagement. So we love measuring biological age each year. Our goal is for you to age 0.75 years a year. Every fourth year is free.
Yeah.
It's Sperity Health on your health span. Okay, we're going to hit our take-home points.
All right, mine is simple. So everybody, you got to ask more of your doctor. You got to ask more from your health system to be your own advocate and ask them to do these things. Like I mentioned earlier, please do these tests for me, or please, can you order this imaging for me? And if they can't, then Sperity is your answer. We will do those things for you and make sure that you stay ahead of the game.
I agree. Perfect.
I'll piggyback on that is that, asking your physician, my take home point would be that seeing what I've been incentivized to do in primary care to, old guy comes in with mildly elevated cholesterol, the things that I'm looking at and being graded on in primary care are not what really moves the needle. It's about 10 years old. And I'm trying to do the best for my patients, and I'm still limited by what, Medicare's grading me on, what Blue Cross is grading me on, et cetera. And I really want to get down to the basics with the patient of what really will help them prevent at the age of 45 what I'm dealing with in the next room at the age of 65. And the structure of the normal primary care reimbursement model of corporate medicine does not give you that. It incentivizes you to get down and get out as fast as you can to someone who has minimal problems. And I would say to the 45-year-old that's already showing signs of insulin resistance or metabolic dysfunction, inflammation, that is my window to really intervene. And that patient may not know the right questions to ask their physician. They don't know the significance of an Lp(a) or what is insulin resistance. And so getting out in the field and telling people when they're 30 and 40, when they think they're invincible, they don't need a primary care doctor. They more need a quarterback, a coach, a life coach to put them in the right direction, to tell them what is insulin resistance. And I would say that, the majority of our people that are trying to do better, trying to be healthy, are very high functioning individuals, high stress jobs. And that is where those people have the hardest time, because we're trying to fit in as much things as we can in that 24-hour period. And so sleep takes the back burner. A stressful day, a whiskey when you come in, that's just the normal lifestyle, and our cultural lifestyle has put us there. And those are the people we really need to reach out to and say, hey, you're just working, you're surviving, you're working the 9 to 5. Here's how you can incorporate small changes that will really make a difference in the downstream things, in the
100%.
long run.
Yeah.
Okay, can I just add
Yeah.
one more thing? Just how people talk about 9 to 5, right? Hey, I work 9 to 5. Why can't we start talking about sleep the same way? Hey, I sleep 9 to 5, right? I think early to bed and early to rise, I think you will get a lot done in the morning than in the wee hours of the night. Just like that.
Something exciting about sleep that I would add to is, the amount of data that we're about to be able to get from sleep with AI is just, it is just exponentially increasing. And a study I recently looked at showed that you could really detect more from analyzing the sleep patterns of what that person is likely to die from, or what their medical conditions are, with an AI evaluation of their sleep patterns. And that just tells us right there, we're just tipping the surface of how important sleep is. And we've got to protect it. We've got to prioritize it.
And AI is a big piece of the future, and certainly in Sperity Health, we've got AI plugged in already and going to continue to do that once it continues to lead us in the right path. I won't add it. Y'all hit them both. Great take-home points. My big deal is the difference between health span and lifespan. The average American circles the drain for 14 years in this country, where you've lost kind of your health and you're still here circling the drain. And so we don't want that to continue. We want that you're maximizing that health span.
Did we talk about the early cancer detection test? Someone asked about that.
Oh, yeah, that's right. Early cancer detection. We love the Gallery test that we use. There's Concierge out there now as well. They're all a great piece of the.
Those are really great tests. I think that they are only limited because of the time that we've had them available. We need more. We need 30-year outcome data. I think this is really an excellent test. And the recent study that came out really does not say that the test is bad. It's just that we need more time to show that this test would be a mortality reducer, and you need a 15 to 30 year span of time on that. It just hasn't been enough time. I still think it's a great test, and we're going to see more and more being utilized in the future.
One came in here, Dr. Sharma. I'll let you have this one for caffeine and cortisol. Do we think caffeine can affect your cortisol level?
Oh, I love my coffee, Grant. You know that. So I know it can increase it. That's why I do tell my patients, hey, if you're going to drink your coffee, do it early in the morning, and then that's it. Caffeine's half-life is pretty long. So if you're drinking that coffee again at 2 o'clock or 3 o'clock in the afternoon, that's going to stay in your system into early hours of the morning. So get your cup. But even if the data comes out, it's not good for you. That's my one vice. I'll tell you, I don't drink alcohol, but man, that coffee is tough to give up.
There's some good data on coffee on increasing longevity. And I will say that sometimes I need a little caffeine in the early afternoon. And I do a green tea, which has about half the caffeine content. We actually have a favorite green tea we use. I'll send it to you.
I would add that caffeine's negative effects on sleep after 2 p.m. actually can be substantial. And it depends on how far you want to go down that rabbit hole. Which vice do you want to take? But yes, overall, caffeine definitely can raise cortisol, raise insulin, feed back to fat storage problems, and therefore reinforce your stress, chronic stress, insulin resistance, poor sleep physiology. which then leads you to do more caffeine. So in an ideal world, no, we drink no caffeine. But again, do as I say, not as I do, because I'm quite the caffeine junkie myself. But
Don't you feel for the people you had a later dinner and all of a sudden they order an espresso martini at 10 o'clock at night and you're like, oh, buddy, you just got a zero.
my favorite.
Listen, I love an espresso martini, but not at 10
No good.
o'clock at night.
No good. Not at 10.
It's 11:58. We're going to stop right here on time. Now 11:59. Perfect. Great discussion. Thanks everybody for the questions in the chat. Dr. Sharma, Dr. Harrison, thank you. And we're going to keep working together to increase everybody's health and longevity, and thrilled to have you all as partners on our team.
Thank you, everybody.
Thanks,
see ya.
guys.